We have a interesting case today. Here's a otherwise healthy and active gentleman with degenerative scoliosis. And he's had several different types of opinions about surgical treatment because he's in a lot of pain, so he needs something done. But in looking at it really closely, it looks like his main problem is just at the L3-4 level, right there, where there's a lot of degenerative disc disease. And there's an asymmetric disc collapse there to the left side, which would pinch off the nerves going to the left leg. And that's exactly where he has his pain. A targeted injection on the left L3-4 transforaminal level provided marked temporal relief. You can see on the MRI, he's got several levels of degenerated disc, but the 3-4 level right there is the worst. And if you look really closely, he's got a big facet cyst. He's got facet fluid signs, stenosis. So we're going to do a minimally invasive reconstruction using the MIS-TLIF technique that will get him straighter, make him taller, open up the space for the nerves, and eliminate the bone-on-bone arthritis pain by fusing those two together. And if all goes according to plan, he can either go home tonight or first thing in the morning. And hopefully within about a month or two, he'll be getting back to his active self again. Because life is short.
And then bring up the stairs for her.
This is a special day today because we have Kenzie Kerr, our new PA, her first day in the OR with us. So she gets to enjoy things without having to do much work. And basically we have to entertain her today so she doesn't fall asleep and get really bored. And then next week we're going to put her to task. And the slave work will begin. So good luck, Kenzie. Making the perfect incision using the computer navigation cheating technique. Because you know my mom always said, if you don't cheat every once in a while, you ain't trying hard enough. Alrighty, I'm doing my internal validation. I'm walking the TP to make sure that it looks like TP, smells like TP, tastes like TP. That way we don't step in it. You know what I'm saying? Oh yes, look at that perfect pedicle screw trajectory. Perfect works. This is accurate. Good bone too. Definitely 45s. It can even be 50s. The red reverse mark is on 45.
Yes.
50 screws. Oh boy, perfect. Feel like such a cheater. It's just not there when it's this easy. Very good bite. Good bone. Thank you for having good bone. Because it's really the little things that keep you going. Thanks, Nick. Shot. I think that's getting worse. Shot. Yes, keep going. It's getting better. Right there. It's probably too much. I got a good view of the facet joint where that cyst is. Also where all the stenosis is. And here's one of the tenets of minimally invasive surgery. Normally we make a big incision that funnels down to a tiny little surgical target site, which is that big. So MIS just makes it so that the surgical corridor is almost the same size as the surgical target site rather than being 3 times bigger. You can't see anything growing around here, and it's very confusing, but that's why we use the force. We use the dark side of the force, but we use the force and navigation to know where we are. Because the old days of seeing where you are by looking all around, that's just silly. Alrighty, I'm in the canal. This is so cool. Thank you for doing that. The anesthesia tour. You don't get that every day. I have a little boy here. It's going to be a boy. I've got the facet cyst isolated. It's always completely scarred down to the nerve. But I've dissected it free and trying to remove it now without injuring the delicate membrane of the dural tube. Because you know what my mama always said, spine surgery would be a lot easier without blood vessels and nerves. Oh, what am I going to do with this thing? It's gold and shiny and very expensive. It's going to go in small. I'm going to rotate it and this thing's going to get almost twice as big. Greedy, I know, but you know what my mama always said. Greed is a powerful force. Put it slightly to my side so that we can straighten you out.
You're not going to have to raise your nails.
Anything, Deborah? Nice. Oh, this is going to feel so good. Nope, I see where it is. It's on my half of this spine, just like I was hoping. And then come in like this. Watch, this is going to get totally straight. And all the screws are going to line up. At least I hope. So far, so great. Should we put in screws on the other side or no? What do you think? So, oh, it's so symmetric. It looks like we only put in screws on one side. Hence our joke. That was a perfect wag. 5th degree black belt right there. Now for the interbody erectione. I take that back. Greed be a powerful force. Nope, that's where it wants to live. Anything beyond that is not greedy anymore. It's stupid. Oh, it's getting bigger. And bigger. Lateral, but the more important one is the AP because you're collapsed on the left side, but not no-mo. That's spelled N-O-M-O. Yep. 2-minute count. 3-minute count. We could live with 2.5 though.
How's the kids go, Dr. Kim?
Well, you know, I'm just sitting down, not a care in the world, a little this, a little that. Surgery was really boring. I'm going to go take a nap, but that's good for you. You know why? Boring is good in spine surgery. So best of luck. The surgery went perfectly, so now you have to be the perfect patient for rehab. And then we have our new PA, Kinsey. She's been watching us. She's like, oh yeah, I'm watching you all.
I thought it was interesting.
Oh yes, look at this. So this is the AP view, frontal view, and I have the cage slightly on the left side. This is the left side because he was tilted over on the left side. But here's the more important view, the lateral view from the side, which shows how tall, much taller he is and more leaning back. That's called lordosis. So you should feel an inch taller. Surgery's all done. We did it through these 2 little incisions that are about 1 inch long. It looks a little gnarly with all this blood, but that's the way we like it. Otherwise it's going to look silly and unmanly without some blood around. But I bet you that incision is going to heal beautifully and your back modeling career will hopefully be intact. There's a little navigation tracking pin poke hole right there. That's where we use 3D navigation to cheat, know where we are in 3-dimensional space. So get well soon. We're all rooting for you.